I'm just going to give a quick intro and then I'll introduce the three of you if that works. So everybody, just thank you so much for joining. Anthony from OpenStax, and I know that it's been a great conference, and a lot of you have heard this intro before. So just this is for the folks that haven't yet. We are providing this workshop and this event overall in partnership with the Texas Higher Education Coordinating Board to showcase and create a dialogue mostly around the new nursing series, the one program that consists of 8 nursing textbooks and associated resources to support nursing education. And these are developed by OpenStax at Rice University and in conjunction with the Texas Higher Education Coordinating Board. But they're national resources. They are meant to be aligned to the national standards to serve exams like the NCLEX, to address needs across the country, and our speakers are from all over as well. So and we're doing our best to provide resources that everybody can use. They're open educational resources. That means they're openly licensed, and that you can use them, as we've discussed a lot during the conference, in different ways for different types of courses. You can remix and put them into your LMSs and cut them apart and edit them if you want to, or just use the images or just use parts of them. But they were developed with the input of dozens of faculty per book, specialized in that course, medical surgical nursing, and addressing the needs of that course, the needs today, the needs tomorrow, thinking about what the students about how the exams play out, the AAC and essentials integrate, and so on. And so they are meant to be used off the shelf too. Use them as you'd like. To reach them, we'll share a bit more of this in the chat, but you go to openstax.org and you'll be able to see them. They're not available quite yet. We'll post some links in the chat in a bit. And just a couple of things about the session itself. So this will be recorded, and we'll share the recording afterwards via our YouTube channel, and then you'll get links to things like that, and the survey, the follow-up surveys, and so on, in follow-up emails to the session. If you need captions, we have live captioning available. You can click the captions button at the bottom of your Zoom, and if you don't see it, there's a little more button in most cases with 3 dots. And if you're not seeing the captions, if you click that more button, you should get it. If anybody has any questions, let us know. And sort of 2 other notes. This is put on by OpenStax. You can learn more about us at openstax.org, and it's put on by the THECB. And the Texas Higher Education Coordinating Board has created a nursing hub, for one program hub, where it will include all the resources and also links back to everything from the conference itself, and also places where you can join groups to have dialogue and discussions about the series, about what you're doing. In the last couple of sessions, we had a lot of conversation about how people can use certain resources, what they're doing in their to transform to CBE, and so on. So all those discussions can take place in that summit. We'll put a link in the chat. And then finally, at the end of the session, towards the end of the session, our partner WiseWire will talk a little bit about some workshops that they're offering, open workshops, one on mapping to curricula, mapping these resources to different types of curricula, as well as more intensive NCLEX. We had a great NCLEX workshop yesterday, but they are offering some workshops on that as well. And we'll have them speak and show the sign up form for that towards the end. Okay, a lot of preamble from me. Thanks again so much, everybody, for joining. I'm really looking forward to hearing what our speakers have to say. So Bridget, Maren, and Jessica, please take it away.
All right. Thank you, Anthony. All right. So I'm going to share my screen. And if you've been around doing these things since 2020, it's not really a presentation until we say that. All right. Can I get a nod? Do we see what I'm doing? Can we see it? I see Maren nodding. Okay. Thank you. Well, hello, everybody. My name is Bridget Carey. Oh, I love little emojis. I'll try not to look at those, but thank you for the feedback. Let's do a little objectives. We love objectives and knowing what we're doing. So I'm going to just do a little introduction of the team that was behind the Med-Surg nursing text. And then really our goal is to try to get you excited about this, right? Med-Surg, depending on where you are and what you're teaching or how you teach, it's usually It's a huge lift, right? So we wanted to get you excited, get us excited. How can we really rethink this and make this applicable to the new learner while honoring our nursing curricula and educational components? So let's do the introductions before we get excited. So my name is Bridget Carey. I am the hologram on your screen. If this is an indication I need to get a new camera, that is it. I have been a nurse, oh my gosh, 14 years, crazy. I have my master's in nursing education with a specialty in curriculum development. I'm a board certified wound care nurse. I did adjunct faculty teaching. I say did because I had babies and I'm getting back to the classroom soon, but teaching at Holy Family University in Philadelphia, Pennsylvania. I'm a published author, both in academia as well as in the content marketing, excuse me. And again, I'm a legal nurse consultant and expert witness for wound care. Going to introduce Dr. Jessica Palozie. She is an assistant clinical professor of nursing at the University of Connecticut, UConn. She is an acute care nurse practitioner at Hartford Healthcare. She has been in nursing for almost 2 decades, with 15 years as an advanced practice nurse, with 11 years in higher education, spanning the whole curriculum from associates, bachelor's, master's, as well as DNP programs. She's actively practicing hospital-based medicine, as you can see. Give a little wave, Jess, coming live from the hospital. She also has experience with mapping to the AACN Essentials concept-based curriculum, develop of laboratory and simulation to meet clinical behavioral objectives, and as well as integration of the CJMM through the flipped classroom. Also noting, I am from the East Coast, so if I'm going too fast, as I hear myself, give a little response as well. I'll slow down. Definitely accept that feedback. And then last but not least, always in alphabetical order, is Dr. Maren Reinholdt. She has 14 years in academic nursing education. She has been an RN since 2009, also served as an expert witness in medical legal cases, and is published in nursing journals. So there she is. Don't forget, she's an assistant professor of clinical nursing at the University of Rochester School of Nursing. So how do we fit into this mix? Where do we come in with the medical surgical nursing text that you're going to learn more about? Well, Dr. Palozie, Dr. Reinholdt, myself, we were selected in fall of 2022 to brainstorm and collaborate. I like to think of us as the bumpers, to be the bumpers, if you will, and subject matter experts on how we could lift and really reinvigorate the medical surgical textbook. Some of our tasks, I'll come back to the quotations in a second, but our tasks included content development, organizing, crafting a table of contents, considering obviously client needs while integrating processes and clinical judgment model, which we know that's huge. So how can we bring that in a digestible, engaging manner to the med-surg world? And always keeping in mind the foundational sciences of pathophysiology, pharmacology, psychology, and really the holistic component of nursing, balancing that art and science and hitting the learners where they are and how they learn. So I did the quotations in the beginning because as educators, we know our job description, we go beyond that, right? So we really work to envision what the potential for the next generation of learner could be and how we can bring forth our knowledge base, our experiences, and really up-level that. So we know sometimes patho doesn't always change. It does, but doesn't. But how do we make that invigorating, exciting, and digestible for the learner? So I hope that gets you excited to see what we have done. And now let's talk about what makes this text different. What is the differentiators from what we are doing with OpenStax and the open resource, and how you can utilize this. So I believe, Dr. Palozie, you are up first.
Oh, forgive me. I'm going to have to go off my memory here. So when we're developing this textbook, we wanted to keep the students engaged with versatility. So we've implemented a number of things called feature boxes. We also needed to thread all the new CJMM terminology because we had to break away from nursing process. It's also important that we thread the best current practices and integrated that into each of the chapters. Also, too, the book does a nice, concise it's thorough enough, but it's not there to replace pathophysiology. So the opening chapters have that developed into that. Also, too, for learners, part of trying to motivate learners to be active in their learning, we have worked very hard to have really strong post-assessment assessments. We consider the Bloom the best practices for Bloom's taxonomy with higher level application and analysis questions. We also have digital clicks because our current learning population, at least in mine, are very digitally savvy and they like to click and see things. So we've integrated that to look at population data. And also we need to think about conceptual terms because we are breaking away from nursing diagnosis, and we try to integrate that cohesively in all of our chapters, like perfusion, intracranial regulation. So that was one of the foundational blocks that we were considering when building the table of contents.
Unmute my microphone here. So integrate, we're going to dive into 3 specific areas that we really think elevate this med-surg text and help deliver content in a unique way that introduces and represents what real-world modern nursing practice looks like for the learners. So first, we integrated the clinical judgment measurement model into the text. So the clinical judgment measurement model, for those not completely familiar with it at this point, I think we all are as nurse educators, but it was developed by the NCSBN as a way to measure the clinical judgment in the nursing profession, and particularly to evaluate the preparedness of new graduate students via the NCLEX. So gone are the days of using the nursing process and NANDA diagnoses, the way that traditionally nursing education has brought through the years. We want learners to adapt to the way of thinking about clinical problems that are consistent with the CJMM, I'm sorry, that really resonates with what nursing practice looks like today and will look like in the future. And that's how we present nursing care throughout the text. To integrate the CJMM into the text, at the content leads, we created an outline for the nursing care associated with each disease exemplar or condition that we discussed in the book. This outline contained a section for recognizing and analyzing cues, prioritizing hypotheses, generating solutions, and taking action. And then a third section in evaluating outcomes. Then each writer, who was a nurse expert in each respective content area, created the section describing key details of the disease process or condition and relating them to the nursing care and the steps of the CJMM. For example, I wrote the cerebrovascular chapter, and the recognizing and analyzing cues section included recognizing stroke symptoms with the FAST algorithm, facial droop, slurred speech, decreased arm strength, particularly on one side of the body, and then talk further in analyzing those cues. The nurse weighs against their knowledge of the specific disease processes and specific client details to figure out what exactly could be going on. In this case, the nurse would prioritize hypotheses. Based on the assessment data, the nurse could say this client could be having things like migraine, TIA, hypoglycemia, or a stroke, and prioritizing that care, going forward with stroke care and generating solutions. We need to make a quick call to the stroke response team, and I need to focus on maintaining patient safety and maintaining the patient's status. How am I going to do those things? Take action, right? Notify the stroke emergency team. or whatever it happens to be at the institution that you're working at. Make the client NPO, nothing to eat. Assess the patient's oxygenation and perfusion by looking at their vital signs. Then finally, evaluation and outcome, linking back to the cues that the nurse recognized as abnormal. How are they treated? Are they better? Are they resolved? In this case, we're looking at the immediate action leading to prompt diagnosis and treatment, and maintaining the patient's status, right? No injury and no decline in their status as they get prompt attention. Okay, thank you for switching to the next one. So another aspect of this text that we think is quite unique is the addition of the the addition of feature boxes. One that I particularly like is the Real RN Stories, which actually takes you into the world of a nurse and tells you where this nurse is working, how long they've been practicing, in what area, and talks about a scenario that this nurse came across related to the content and how they handled it. So not only could the Real RN Stories be talking about application of the CJMM steps and application of the nursing care that we're talking about in the text, but they also bring to life the experience of an RN, and it might touch on the emotional aspect of dealing with whatever scenario you happen to be faced with. The Real RN is possibly my favorite addition to the book. We also have a feature box called the Multi-D Plan of Care, and that focuses on the interdisciplinary care for a condition or disease process that we're talking about in the book, whether it be including physical therapy, occupational therapy, nutritionist, social work, pharmacy, case manager, respiratory therapy, etc. We are talking about this collaboration, which is part of the AACN Essentials for Baccalaureate Education. The next feature box is the clinical safety and procedures. We're highlighting that connection with CUSIN competencies. And these come in many forms. It might be diagrams, it might be instructions, it might be why something is done to promote one of those 6 outcomes for CUSIN, those 6 competencies. The next feature box type is the life stage context or cultural context. And other texts do include age-related or cultural-related considerations. That's not necessarily new, but by talking about them as life stage context or cultural context, it helps students pay attention to the subtle differences or the obvious differences that they will need to recognize in order to alter their approach to patient care. They don't replace the integration of diversity and inclusion, in the entire chapter, but they do adhere to those guidelines. So we are respectful in talking about different life stages and cultures. Our manner of speaking is still diversity and inclusatory, but it brings to life some more of the real world situations that your student nurses, the learners, are going to be faced with in practice. Finally, read the EHR is another text, another feature box found throughout the text. And read the EHR includes just what it sounds like, some part of the EHR, the electronic health record or medical health record, that is so common in their clinical situations for students these days. And, most hospitals, outpatient centers are integrating use of an EHR or some sort of an MAR. So by presenting a student or a learner with a text box that presents the information that they want to see on an EHR, and then presenting them with some critical thinking situations like what concerns you the most? What is an expected finding? What information would you like to get in addition to what you see right here? The nurse is using that clinical judgment kind of thinking that will assist them in navigating through both NCLEX preparation with the CJMM, but also this complex clinical world. And then our final aspect, which I really enjoy, especially for this type of book, because it has this open online platform for availability, for accessibility, is the link to learning feature boxes. And while reading through the text, the learners will see links to learning. And these are opportunities that the writers have selected that will give the students a chance to just get one click, and that will send them to the website that maybe further explains the topic that they're talking about. I'm thinking about in the cultural chapter, or, I'm sorry, specifically the ethics chapter, is a link to the ANA's Code of Ethics. So the writer does talk about it, but gives the learner a chance to delve deeper into the topic and go back to the original source. So I believe that not only helps the students understand the material a little bit more, but it also helps them to learn what are good, reputable resources, because we're taking them back to where it is originally from. So I think that's an excellent resource that will give our learners a little leg up on understanding not necessarily just the concept that they're talking about in the text, but kind of the history around it. They can delve into a little bit deeper to learn more. Okay, and then we have Dr. Palozie going to talk about the third aspect of the book that is a unique piece.
There we go. Sorry about that. So, in unraveling case studies, we were trying to think of how to fit a case study that it's not siloed in each chapter. So, we're trying to contextualize a potential clinical scenario the student may encounter in their clinical experiences. And you want to paint that picture for the students, so when they go into clinical, they can bridge those concepts. So the recommendations of where these case studies could be unravel in multiple chapters. So for example, we had a gentleman, I can't remember his name, 70-year-old gentleman who was a smoker. He had heart attack, he had high blood pressure. So he was threaded through the cardiac chapter, and then we found another chapter to stick him into, because our students are seeing complex patients. They have a lot of comorbidities. So we're trying to use these case studies in multiple chapters. It's rare that a student's going to see a patient with one comorbidity, but also it's going to challenge them to think of the CJMM for those acute exemplars, while considering the other disease processes that are affecting the patient. They struggled to apply like what is first, what is second, what is third. But we hope that this book that has been adopted with the CJMM threaded through will help close that gap between academia and practice.
I think that's where we stop.
Yeah,
We left you on a cliffhanger. Are you guys excited? So I guess where do we go from here, Anthony? Is
Okay.
Dr. Palozie, Dr. Reinhardt, any last comments? I think we did a great job, but we're excited because we've been working on it and living it. So we'll pass it back to you, Anthony.
Yes. Anybody any comments from Dr. Palozie, Dr. Reinholdt?
I'm just excited being one who teaches med surg in the academic setting right now. I'm seeing applications for the use of this book everywhere, and I'm seeing the real world connections as something that's really valuable for the students. It's not dry reading, it's real reading.
That's great. Thank you. So we're getting some questions about sort of the availability of the book. Let me address some of that, and then if anybody has any questions about the you know, any of the more specific material and things like that, please chime in. We're publishing, you know, right now, and thank you so much, Christiana, for posting the link to the sample. We can you can go ahead on that site and get to the actual sample, which will have the full table of contents and then a couple of design chapters. We'll be increasing that over the coming months, sort of as we develop our resources, and you know, we'll be expanding so that you have the full sample. If you notice some of the other books in the series, Population Health, Nutrition, for example, right now it's still not final, but we have the full sample so that you can look at it. So we'll have that for the medical surgical book and the other textbooks, you know, in the coming months. And then, yeah, so we don't overpromise anything. And so as you saw, Lindsay posted, if you just scroll up, everybody in the chat just a bit, Lindsay posted the timing of the actual other releases. We will have things, you know, in really good shape before then, but we want to make sure we're being, you know, really clear on what we have and when we'll have it. So, you know, that's when we'll have that. So we're listing medical surgical as September, which we know, of course, is a little tough for adoptions for the fall. We will do everything we can to bring it in earlier, but also have those full samples out earlier than that. And then, as you see, yeah, so that's that. And then, you know, I'll mention just one other thing, is that there was a question about the book itself. But so when there's also ancillaries that are accompanying the book, you know, sort of the test bank, lecture slides, and so on, those will be available too. And so we know how important those are to you know, when considering a textbook. We had one question in the chat. And then, and I'm not sure if actually if the three of you could answer that as distinctly in terms of quantitatives, but then we'll look in the Q&A as well. So one of the questions in the chat was, do you know how many case studies there are in the book?
I think that, so we have a writer that's working judiciously through all the chapters and finding places to put these multiple patients. So we're trying to hit case studies in the big exemplars that, you know, students are going to encounter. Pulmonary's one, neuro's one. I think they're talking about, we're going to put one in for cardiology. And those are the ones that I'm thinking of off the top of my head when we were kind of building this scenario and what it would look like and how we thread it through the text.
And I wonder if that person was asking the number of unfolding case studies or just case studies in general, because we do incorporate other case studies and kind of mini case studies. What would the nurse do? Kind of application-based questions at the end of every chapter.
Yeah, if anybody else wants to chime in on that, and I'll speak to a question that Casey had, but we had two other questions. Well, actually, one question I think came from Cindy in the Q&A. You mentioned not using the NANDA diagnosis and focusing on clinical judgment model. Do you still use NANDA diagnosis and nursing process in the book?
Yes and no. And the reason that we've eliminated NANDA is because NCLEX doesn't use it. And I was taught NANDA, and it's, you know, I think it's a metamorphosis every educator and every nurse has to go through. We're breaking away from those NANDA diagnoses. So we're saying, okay, what are the priority concepts here? You know, and we want our students to identify that. So we are veering away from that, and it was tough. It was a very tough transition, especially a lot of our writers. They had to make those changes too when we were building this. So yes, we are eliminating the NANDA diagnosis just because National Council does not include them on boards anymore. but we use a lot of concepts.
And
Yeah.
also, just to chime in too with Dr. Palozie, there is a chapter in the text that is nursing process, connected with CJMM. So still, yes, highlighting, but showing how those two concepts, the nursing process and the CJMM, showing how they connect and how they overlap and work together.
Yes, and I'll chime in as a third party on that. So we're not saying goodbye forever, right? Because that's how we've all learned and how to translate and bridge that gap until Nanda's completely gone. In that original, it's one at the beginning, I think it's 1 or 2, where we differentiate nursing process, CJMM, kind of understanding that gap, and how like almost encouraging the student to move forward as a CJMM, but understanding what the nursing process is, how it was thought about, taught, but then moving forward into the future, this is how we're going to approach care. So it's like not like we're saying, yes, gone forever, but we can't forget it, right? So especially because I saw in the comments, yes, they're still using them in documentation. Yes, we are a long way away from just saying goodbye in documentation. So we acknowledge it, but we're really pushing for the CJMM and moving towards the future.
And I noticed one of the comments in the chat was, I think you were just answering to it also, Bridget, that charting systems still use NANDA. Some do, but some use problem-based and collaborative diagnoses rather than NANDA language. So NANDA is not used consistently throughout the real world of nursing.
I thought we had another attendee who actually had raised their hand to speak, and now I can't. I don't know. Actually, I don't think I can see them anymore. Okay, so Nisha, if that's how you pronounce your name, I apologize if not. Please re-raise or put in the chat if there's anything we can answer, or maybe you can speak. Maybe I'm wrong.
And there's one more. I'm going to just jump in real quick. So our editor, look how fancy we are. We have an editor that is helping us through this process. Just wanted to kind of go back to the unfolding case studies real quick, just to clarify, because there was a question about how many. So the big ones, there are 2 unfolding case studies, each encompassing 3 chapters. Other chapters will have what will the nurse do as mini case studies. So I hope that brought some clarity to that question.
That's great. We had a question come in about the updating process. I think I can address that. So there's a few different ways and different considerations around updating. And so, sorry, everything depends. But so for anything that's sort of that's the wrong word to use, acute in a nursing audience, but anything that's sort of immediate or kind of small, a specific word, an error in calculation, we don't do this standard has changed or something like that. That's relatively confined. We do those updates relatively frequently, and actually maybe even more than once a year. Through our typical errata and updating process. And we will do that, and we take every bit of guidance. And it's not the authors aren't obligated to read through every paragraph and consider everything that changes. But as you mentioned, we have editors, we have team members who keep an eye on this sort of things. Hey, this has changed. This is going to be a big deal for the textbook. We need to incorporate it. But we also very much welcome and very much make public any suggestions and errata that we get from the community. And that actually includes faculty and students and anybody else who is using the book and wants to suggest comments. Now, I say suggest because it's not a wiki book. We don't just take every suggestion we get. Some of them, it's also not on the community to come up with the exact right answer or how exactly to phrase something. But everything that comes in, and we've taken hundreds of these, we qualified, experienced faculty, subject matter experts evaluate the comments, see if it's valid, see if it's accurate, see the best time to change it, and also see if it's the right size for a change. If somebody's asking us to add a chapter that's a little bit different from changing a sentence or a paragraph, and we take those comments in, and we keep a record of that. That's very public, that everybody can see. In terms of revisions, we do those every couple of years as needed. Jessica had to leave. Oh, she already took off. But okay, so it was so nice of her to join us, especially from the hospital. We don't get that very often. So
She had to tend to a patient.
Okay. All right, got it.
We get it.
Yeah, definitely. You all do. So we'll do those updates, and of course, we'll share those upcoming updates, the opportunities for change and input and feedback, as the text gets used and evolved over time. On the THCB Nursing Hub that we've provided a link to a couple of times, and through OpenStax as well. Any other questions, comments? We'll give everybody just a minute here, or a couple minutes. No rush. As I mentioned when we started off, so I think that the authors have provided great insight into how they develop, what they considered, and how they developed it, and it's a very robust offering. It's I don't know if we got the page count to you. I think we had a question for that. We actually don't know yet because it's not done. But I would say well over 1,000 pages. I would sort of put in that mindset. OpenStax books we design in a very accessible format that sometimes actually has a higher page count to increase readability sometimes, but it is available open and freely in multiple formats. So you can get it online. If it's okay, I'm just going to do, I know some folks have seen this before, but just do a quick screen share on my end of how you would get to the resource. I'll do that really quickly. And then we'll show you the the Nursing Hub as well. So if you see right here, I'm on the OpenStax page, and I'll start from the beginning. I go to OpenStax. You can get some help. You can log in. That's how you get instructors' assets, ancillaries, and other resources. We just have to verify that you're a faculty member at a school, and if you're not, we actually still can have you join. It just takes there's a little extra step there. But you would go to the subjects, nursing, and you'll see, the books that we have complete samples for are posted here. And you can go ahead and take a look at those now, and you'll see, the downloaded PDF sample. When the full book is ready, you'll see multiple links there, the online view, the download of a PDF, other ways, including print to obtain the textbook as well as partner resources and so on. And then we mentioned the Essentials Hub. We put the link in the chat, but you can go ahead to this page, and there's a few things you'll see on here. One is the information about the summit. So we're in the summit now, but there will follow-ups to that. That will have links to the videos. We'll have other resources around the Nursing Summit and the one program. And then this is where you can get additional samples, including the Medical Surgical Textbook. And I thank you so much, Christiane, for putting a link in here. And then below that, you'll see these groups for each discipline, each course that we're addressing. And of course, we know many of you teach multiple courses, and there's certainly crossover between courses and audiences and so on. But you can go ahead and join a group. There probably aren't many people. There's 9. It's outstanding. Thank you so much. In this group now, they'll increase as we start to publish and the books are available. These groups get to be hundreds of people, and they change over. They have an opportunity for discussion and talking about how they're using the resources, addressing issues. There's been a lot of discussion during the summit about remixing and reusing in different course environments. That's a place where people sometimes do that and then share the links to their remixed resource in these environments and so on. Sorry, I should have clicked this one. So you'll have that opportunity as well. So please go ahead and join those. And you'll have the opportunity to share and connect with folks from around the country. Note that, as I said earlier, this is, this hub is developed by such as Higher Education Coordinating Board. But note that these are resources that the whole country can use and also join, in that hub in that group to discuss with other faculty. So I'm just going to look at that Q&A real quick. And the chat to see. Oh, thank you so much, Carrie, for sharing that. Okay, so okay, sorry, I'm just making sure we're covering everything here. Again, thank you all, everybody, for joining, and especially to our authors for sharing about the book, how you came about it. I want to turn it over to Dina to speak in a little bit. Dina, I'll make you a panelist in a second. But any other final comments or anything you want to share, Bridget and Maren? Anything you should you want to get across as we wrap up?
Real quick, I just want to say we had, Anthony, thanks to you, we had an opportunity to look at the sample, just because we've been behind the screen, behind the words, and just hoping that it translates, and looking at that fluid and electrolyte sample that's ready. So excited. And I know as these texts and resources will come to fruition, we have an idea of how to use it. Obviously, it will not replace all traditional resources and things, but this is going to be an incredible supplement and a tool in your toolkit to help elevate and make the not so fun and interesting for learners, right? That's our goal. So I'm very excited about it. I just want to put that. If you can't feel my excitement over here.
And I am, yeah, thank you, Bridget. I'm so excited too, because it's really looking at the contemporary needs of nursing education today and how we prepare students to become nurses.
That's great. And just again on how you can all use it. I mean, we would love everybody to use it and use this textbook and the others as their main text for their course. But there's many ways to use these open resources. You can use parts of it. You can use just the chapters you need for a specific audience. You can link to them from your LMSs and everything like that. We share a lot of resources on how you can do that. And even later in the day, when Christy Bowen speaks about implementing the resources, we'll talk a little bit about that as well. But one of the ways that the other aspect of this is mapping these resources to curriculum and different types of programs. And as we mentioned earlier, our development partner WiseWire has developed or is providing a couple of, I'm going to stop sharing and reshare if it's okay, a couple of workshops that everybody's invited to. And let me just, I know I had this problem yesterday, so let me just share my screen. And Dina's just going to share a bit about that with us. Dina, thanks so much for joining.
Thank you so much, Anthony.
Yep.
Appreciate it.
Go ahead, yeah.
Yeah, thank you. Hi, everyone. I'm Dina Justin. I'm from WiseWire, a director at WiseWire. And this was a really excellent panel today. We at WiseWire have been development partners with OpenStax for a very long time. We're essentially architects of digital learning. And as Anthony mentioned, we've worked side by side with the authors on the development of this books and others, and we work really closely with nursing programs. As you saw today, we have a wide range of experts on our team, and they're really dedicated to enhancing educational content with a real focus on learning, outcomes, and quality. So because we also provide these tailored mapping solutions, we're extending an opportunity to you for a mapping deep dive, and it's only for one summit attendees. These will be 90-minute online workshops where our curriculum mapping specialists will focus on textbook mapping for your very specific use cases, and you can indicate those on the form. So it's a great opportunity for you to leverage our team, and they'll be interactive, hands-on, with very practical solutions. So please feel free to sign up at this link. We're going to drop it in the chat. It's a tiny URL, easy to remember. And then once we've collected all of the different goals for the signups and have a good understanding of who signs up for what goals, we'll determine what the dates and times will be. And then we have a second workshop, which is NCLEX Prep, with our certified NCLEX writing specialists to provide even more support aligning the books to your goals and use cases. So this is also another level of that. These sessions will include item writing and customized practice tests. So please feel free to sign up, express your interest. If you're not interested in these, you can let us know in the forum or make any other requests, and you can let Anthony's team know if you have any other questions. So thank you so much, Anthony and team. I appreciate it.
Thank you so much. Yes, I mean, so many people come together to develop these books. You can imagine just flipping through the sample that we did, all the editing, the graphic design, the accessibility, the alt text, the technology behind it, making it appear in different formats and making it usable in the online format with notes and highlighting and other things like that, as well as a downloadable PDF. So much effort that goes into that on the WiseWire side, the OpenStax side, the author side, and then all of our faculty reviewers that play a deep role in the development of these texts too. So everything the authors do is reviewed by reviewers, and then editors and the authors themselves feedback, and it goes round and round and round on that process until it's ready for publication, and that's what takes so long. And we'd love to share the resources, and then build out the community as well. I believe I just saw a raised hand. Let me make sure we are. I can do that. Let's see. So I'm gonna get to that. Cindy, I'm gonna let you talk in a second. You just have to unmute yourself though.
I'm sorry, I didn't mean to
Okay, sorry
raise
about
my
that.
hand.
Okay. All right. That's great. No problem at all. Lori, I see you have your hand raised too. So you can go ahead and chime
Oh,
in.
sorry, I didn't mean to.
Okay. Good. Cool.
Maybe they were just high-fiving us.
That's right. That's what we all need. A little. Everyone needs a little high five. Cool. Thank you again, everybody who played a role in this. As we mentioned, as you see the links in the chat, there's links to the THCB Nursing Hub. There's you've seen links to the OpenStax, and also tiny URL to sign up for those workshops with WiseWire. Just for the next session, as it's a little bit up in the chat, you'll see a message from Amanda. Starting right after this session, we have a networking session. So this is not a presentation from us. I won't be doing any talking, so I would be thankful for that. And we'll have the opportunity just to coordinate with each other. And I know in earlier sessions today, especially, and a little bit in this session, a lot of discussion about sharing ideas, or how did you do this, or how did you adapt this? I'd love to see what you did there. So that's what the networking session is for. Of course, not everybody can make it, and there's other opportunities beyond this to do so, but we wanted to provide that. So if you all want to join, anybody want to join that, feel free. We'd love to have you and love to connect, and anything we can do. There will be OpenStax team members on that session. So if you have any questions about, how do I get this resource? Tell me about how it's used. Where can I get it? When the ancillaries come out. Though we'll be able to answer those questions during that session as well. But again, yes, Amanda will be there. I won't. So you're in better hands. Thank you so much, Bridget and Maren, for sharing. We really appreciate it, and thank you to Jessica who had to go help a patient. That's wonderful. And really thank you all for joining and all your interaction engagement. We really appreciate it, and we'll see you soon. Thanks so much, everybody.
Thank you all.
Thanks.